Is this working? Can you hear me? Right. Hey guys, my name's Ron Linus, and I would like to thank you for giving me a few minutes of your time for me to talk about what my organization is doing for people over in the Congo. I work with IHR, which stands for International Healthcare Research, and we are over here in the Congo helping build hospitals and train doctors, because right now the healthcare isn't as good as it should be. Do any of you know where the Congo is? It is located in the center of Africa. And right now the temperature over here is pretty warm, which may sound good to you. So our goal over here at IHR is to inform people about how severe the healthcare problem is over here in the Congo. And we want to be able to make a difference by increasing the access to medicine and training more doctors so they have the proper techniques to deal with any problems that may arise once we leave. Some of the sicknesses that we have to deal with are hepatitis A, which causes problems with the liver, and is generally found in places with low sanitation. We do have a vaccine available for this sickness, and if the person is showing symptoms for more than 6 months, we will inject them with the vaccine, which will help the body fight off the sickness. The problem is that the vaccines that are needed cannot be afforded. So more and more people are dying because they don't have the money that they need for the vaccine. We've been over here for 10 months already, and we have been able to train 32 doctors with basic skills required to save someone if they become sick. We are now focusing on raising money so that they can have the equipment and medicines necessary. The biggest way that we've been raising money is through donations. We've had donations from 53 different countries already, and all it takes is a few dollars, A few of the other sicknesses that we have to deal with are hepatitis E, malaria, plague, and many others. IHR has sent us over here with many specialists for different types of sicknesses so that we are able to cover any sickness that comes through our doors. Every 6 minutes, a child dies in the developing world because the healthcare treatments that they need cannot be afforded. The treatment costs less than a cup of coffee. This is why we're trying to inform the public of how little it takes to help. It breaks my heart to see all the children as well as adults that aren't getting the treatments that they need because they cannot be afforded. All it takes is a few dollars to make a difference. I have been chipping in my money where I can, and all the work I do is voluntary, because we want our organization to focus on putting the money that they have to the people that really need it. The satisfaction of helping people that are dying is reward enough for me. I've met so many nice people, and I've worked with so many nice people, and they're some of the nicest people I know, and they do not deserve what is happening to them. I just have one more thing I want to talk about before I leave, and that is the corruption of the government. It is one of the worst in the world, and it has been one of the worst in the world for almost 6 years. From 1965 to 1997, the Prime Minister had stolen $4 billion for his personal use. That $4 billion could have been used to save 1 billion people from dying of sickness and disease. So this is why we are helping these people, because if their own government won't even help them, they at least need someone to look after them and get them the treatments that they need. If you have any questions or would like to talk to me, I have given your teacher my email address. I would like to thank you guys for having me, and I hope that I've been able to teach you a few things or maybe inspire you.